we're gonna get started in a half kneeling hip flexor position. Take a step forward with your right foot. Make sure your back knee is right underneath your hip. And we're gonna start off with about 30 seconds of pulses forward. You could have your back foot be flat with this one. We're gonna go for about 30 seconds. Taking some deep breaths as you push forward, making sure that you're not overarching at the back. Keep a little tuck. You should just feel a gentle stretch in your hip flexor. Good. Now change sides. Keep a little bit of tension in your core, no more than about 2 out of 10 effort. That'll just help prevent the back from overarching. Some deep breaths. Good. Change sides. We're going back to the first leg. Now we're going to do an isometric hold. So we're going to come off the back knee and we're going to hold here. You can come up a little bit higher to make it easier, but ideally I want you just a few inches off the ground from that back knee. We're going to go for about 20 seconds. Deep breaths. One more breath. Good. Come down, change sides, and get that back knee up off the ground, and hold. Deep breaths. Stay nice and upright. One more breath. Good, come down. Shake it out a little bit. Come back to the first side, right leg forward. Now we're going to be doing an isometric contraction. So we're keeping our back knee down, but what we're going to do is push that back knee kind of into the ground. Think of squeezing the back glute as we do that. We're going to be contracting our hip flexor and our glute here. So take a deep breath into the diaphragm. Exhale and push that knee down. Squeeze that back glute. Hold. 3, 2, 1. Relax. Maybe push a little bit further forward. Nice and upright. No arch in the back. Maintain that pelvic tilt. Breath in. Exhale, contract. Push that knee down to the ground. 3, 2, 1. Good. Relax. Increase the range of motion. 2 more times. Breath in. Exhale, push that knee down. 3, 2, 1. Good. Relax. And last one. Take a deep breath in. And hold. Push that knee down. 3, 2, 1. Good. Relax. Shake it out. Switch sides. Get ready for that first contraction, pushing that back knee into the ground, squeezing the back glute. Breath in. Exhale, push. 3, 2, 1. Good. Relax. Increase a little bit. Breath in. Exhale. Push. 3, 2, 1. Good. Increase range of motion. Heart is nice and upright, chest is proud. Breath in. Exhale, push that back knee, squeeze the back glute. 3, 2, 1. And one more time. Breath in. Exhale, squeeze and push. 3, 2, 1. Good. Relax. Now we're going to be stretching the back side of our leg, the hamstrings. Bring your right leg forward. This one, you can use some yoga blocks for this one. If you have that access to it, if you don't, you can just use your hands. So we're basically coming into a kickstand hamstring stretch position here. What you want to do is curl your back toes up towards your knee. And similar to what we did for that hip flexor start, we're just going to be doing some kind of rocking or light bouncing. Always good to introduce the muscle just with some light kind of rebounding motion. Go about 30 seconds each side. While you're there too, you can get some ankle movement front and back. Keep trying to curl those toes up towards your shin to feel that stretch behind the knee. Switch sides. And if you don't have yoga blocks, you can use your arms down. You could even use one hand on your thigh. The blocks or books, something that you can hang on to, just gives you a little bit more support. Nice thing about doing all these unilateral stretches, so single legs or single limb movements, is that you can kind of get to feel if one side is tighter than the other, which really helps correct those muscle imbalances. Okay, coming back to the first side, we're going to do our isometric contraction hold here. So all we're doing is we're going to lightly push our front heel down into the floor. So toes are going to be curled up. You're going to try to stay as upright as you can with this one. A little bit of rounding is okay. Just make sure you're not super hunched over. Take a big breath in and exhale, push that heel down. 3, 2, 1. Release. Maybe lean forward just a little bit. Curl your toes back towards your shin. Take a breath in. Exhale, push. Push that heel down to the ground. Good. 3, 2, 1. Breathe, increase. I don't want you any more than about a 6 or 7 out of 10 intensity-wise here. Breath in. Exhale, drive that heel down. 3, 2, 1. Good. And one more time. And push that heel down. Good. 4, 3, 2, and 1. Good job. Careful coming out of there. Move slow. Switching sides. Leaning forward. Breath in. Exhale, push that heel down through the ground. 3, 2, 1. Good. Inhale, increase a little bit. Lean forward, curl those toes back towards your shin. Exhale, push that heel down. Good. 4, 3, 2, 1. Breathe. Lean forward a little bit. Increase. Exhale. Drive that heel down. Good. 3, 2, 1. One more time. Big breath in. Exhale. Drive that heel down. Lean forward. 4, 3, 2, and 1. Nice job. Come out of there. All right. To finish off, we're going to go into the world's greatest stretch. So we're coming back forward with our right leg. We're not trying to achieve a super big range of motion here. We're just trying to add a little bit of rotation with our T-spine, our thoracic. That's our mid-back. So I got my right leg forward. My left hand is down, right about a foot, maybe 18 inches or so from my right foot. First, we're going to start with our back knee down, and then we're going to lift it up. So to start, we're going to twist and reach open with our right. As soon as you feel any sort of resistance, I want you to stop there. Push your thumb and your index finger of the grounded hand to the floor, and then see if you can achieve a little bit more motion. We're going to do 3 breaths. Inhale. Exhale, push that thumb and index finger through the floor. Try to twist open a little bit more. And again, breath in. Exhale, push that thumb and index finger through the ground. And one more. And exhale. Good. And we're going to switch sides. So left foot is forward, right hand is down. Again, I am reaching up now with my left arm. I'm emphasizing on driving my thumb and index finger of my grounded hand to the floor. I'm breathing into my diaphragm. Exhale, push that thumb and index finger down. See if you can twist open a little bit more. Make sure you're not arching too much at the back. Breath in. Exhale, push that hand down, twist a little further. Breath in. Exhale, twist a little further, push down. One more. Exhale. Nice job. Coming back to the first side. And now we are just going to try to lift that back knee up off the ground. We're going to reach forward with our right hand and then come up towards the ceiling. Reach forward and reach up. Reach forward and reach up. Two more. Reach forward and reach up. One more. Reach forward and reach up. Nice. Switching sides. Getting that back knee up off the ground. Reach forward. Reach up. Reaching forward, breathing in. Exhale, reach up. Reach forward, breathing in. Reaching up. Reaching forward. And reaching up. Nice job. Get up on your feet, move around, walk it out, see how you feel. We'll see you next time.